My name is Priscilla Bright. I'm a cancer survivor. I've been cancer-free for 7 years. Before I was diagnosed with cancer, I was on a mission. I was taking care of my parents, my mother and father. I put them first. I put myself last. And when I went to do a mammogram, they find out I had a lump in my left breast. I said, well, doctor, how can I have a lump in the lump? I'm not big-breasted. And we made a joke over it. And from that day on, I didn't look back.
My name is Sheila Taylor, and I am a cancer survivor. I was born in Ohio, and I moved here years ago. Before cancer, I had a positive, energetic attitude. I loved hiking a lot. Where I grew up, there was a lot of outdoor parks and walking around along the river. My legs lost their strength and I just wasn't so strong. So I transitioned to move to Houston and went to Harris Health, to a clinic.
My name is Marcela Perez. I am a nurse practitioner for MD Anderson at LBJ. Many of our patients at the time of a diagnosis have never seen a primary care doctor or any doctor in their lives.
My name is Liz Michael. I am with Baylor College of Medicine. I work with the breast oncology department here at Smith Clinic. When I meet a patient for the first time, I allow them time to ask questions. I think it's very important. The diagnosis of cancer is just very scary. It can be very overwhelming coming into this system. So I really spend time with them and give them a chance to ask all the questions and to reassure them that things are going to be okay.
I'm Tamara Saunders. I am a breast surgeon here at LBJ Hospital. It can be overwhelming to receive a breast cancer diagnosis. I often tell them it's like a marathon. There's so many different steps to get you to the end of your journey, but to just keep the faith, be positive.
My name is Casey Duncan. I'm a fellowship-trained surgical oncologist, and I work here at LBJ, and then a few other hospitals around town. In general, the first time they're diagnosed or the first visit, that's always hard. I really like to know about the patient's home life, their personal life, who they live with, what a day in their life is like, because I want to know how the cancer treatment's going to impact that.
My name is Vicki Walter. I am the care coordinator nurse at LBJ. We look at it as roadblocks that we can cross over or go around. We never want to stop at one point. We want to keep going because the whole goal is get me to survivorship, to remission, to clear.
I think the thing that I've noticed with cancer patients in general is how resilient they are. You know, when we tell them their diagnosis, first it's a lot of tears and, emotions, but the patients all tell me, like, I have to do it. I have to do this to live a long time.
I'm not going to let cancer beat me. I'm going to beat cancer, and I have, and I'm going to continue beating cancer. The toughest part was the chemo. I did chemo and radiation, but the chemo, one of the chemo treatment, the medicine was very strong. My treatment lasted almost a year.
I had a lumpectomy done on my right, and I had a full mastectomy done on my left. It seemed to limit my mobility and my desires to be at a lot of places and do a lot of things because I just couldn't do it any longer. But I still said I'm going to find a way.
Coming into Harris Health, patients do not know what to expect. And then they've told me many times that they're pleasantly surprised by all of the outcomes. They've told me many times that they encounter friendly staff. And I'm honestly very proud of that because not many patients expect that.
I think here at LBJ we have a great team, so I really try to reinforce that with the patient, that we have amazing surgeons, amazing oncologists, so they're going to be in good hands, and that the treatment our goal is for cure. Like, we want to cure them. We're not giving up on them. We have a plan in place, and our plan is to cure them of their cancer.
I see about 90 patients a month Our service is probably one of the busiest subset of oncology services. Overall, we may see up to 500 or more patients a month for our entire group. We have an amazing group of people, and we communicate well with each other. We rely on each other. We support each other in our work. We also trust each other, and we respect each other. And I think all those things are key elements in a team approach.
I truly love the relationships I get to develop with my patients. It's difficult seeing them at a time when they're the most vulnerable, but I enjoy getting to take them through the journey, give them information, provide them with a great surgical plan, and see them on the other side where they're healed and happy and relieved.
They teach me to hold my head up when I can't, and I'm looking down at the paper because I don't want to be the first one to cry. So the bonding, the caring, the unconditional love is what I receive from the patients that I see.
The end of the journey is the most exciting when we see them after surgery. We have a lot of patients who have had great responses to chemotherapy, and then we see them after surgery and all their cancer is gone.
When I'm walking around the building and patients stop and speak to me and let me know that they're doing well, and I see them carrying on with their lives, and that's very memorable and happy for me to see that.
Every time that I get to deliver the good news of having clear scans, clear mammograms, it's very encouraging to see the smile on their faces.
I've done this journey for 10 years to talk to somebody new and let them know you can make that decision of fighting as long as you can. Do not give up. I'm a survivor because I chose that I'm going to survive until there's no other way out. And my life is full.
The care that I receive from the Harris Health is second to nothing. Oh yes, I'll ring that bell over and over again. Believe it or not, I have bells. I have bells in each room in my house. I have a bell in my kitchen. It's over the door. And every time I go across that door, I ring my bell. And it reminds me, surviving.